Um, Yesterday, as I mentioned at the top of the show, I got flooded. Actually, I encountered it in the morning on the front page of the New York Times, and I thought, "Oh goodness!" I mean, the headline was essentially, I don't have it in front of me, but it was "No need to supplement with extra vitamin D and calcium."
Really?
Yes,
Huh.
and New York Times, Wall Street Journal, NPR. I was on ABC Good Morning something or other. I got email from friends. I got, you can imagine, my Twitter feed went nuts with our listeners, and then a ton of email, which I knew was going to happen. I of course. So anyway, so I wanted to share with our listeners the reaction that I knew would be coming from the founder of the Vitamin D Council, John Cannell, who's an MD, whose video I have on the Vitamin D page, because he nicely summarizes this. I'll say first of all that this was a sort of a quasi-governmental, and in fact that's his term, agency, the Food and Nutrition Board, and they only addressed the bone strength aspects of vitamin D. So to the degree that they addressed this, they were correct. I noted that 2 weeks ago, there was a news blurb where it was found that 1 in 5 children in the world had symptoms of rickets. So it's certainly not the case that everybody is getting even that incredibly low-level minimum amount of vitamin D required to prevent that. But this spring, as I've mentioned before, I received an awful lot of email feedback from our listeners saying that last winter, because I talked about vitamin D last August, and many people started supplementing. They were reporting in the winter that it was the first, or in the spring following the winter, it was the first time they'd cruised through the holiday season without catching cold and the flu. Mark Thompson, yes, Mark Thompson, my good buddy who does the Analog X website, who's in Phoenix of all places. Well, he actually does live like a bat. I visited his home the other day for the first time, and he has box shutters, all which are closed, so no light comes in the house at all. He is actually running wacky programmer hours at the moment. He gets up in the middle of the afternoon and he works all night long. So and sleeps during the day, so he has to do that, in order to get some sleep. But he was, a couple years ago, he was sick. Every single time I talked to him on the phone, he'd be coughing and sneezing and wheezing. So that I was really actively getting concerned about him. It's like, Mark, you're sick all the time, every time I talk to you. And he's like, oh yeah, well, I just got back from a trip somewhere, and blah blah blah. He started taking vitamin D after I learned about it last summer. He hasn't been sick once since. It completely changed his life. And of course, we know that that's immune system boosting, but remember that, and so not getting colds and flu is the short-term consequence, but the long-term consequence is not getting cancer.
Yeah.
Because it's our immune system that is protecting us all the time from little cancers that are trying to start and are getting zapped before they ever have a chance to get going. So anyway, and I'm not going to do a spin right testimonial because I want to read this instead. John writes, after 13 years of silence, the quasi-governmental agency, the Institute of Medicine's Food and Nutrition Board, today recommended that a 3-pound premature infant take virtually the same amount of vitamin D as a 300-pound pregnant woman. While that 400 IU per day dose is close to adequate for infants, 600 IU per day in pregnant women will do nothing to help the 3 childhood epidemics most closely associated with gestational and early childhood vitamin D deficiencies: asthma, autoimmune disorders, and as recently reported in the largest pediatric journal in the world, Autism. Professor Bruce Hollis of the Medical University of South Carolina has shown pregnant and lactating women need at least 5,000 IU per day, not 600. The FNB also reported that vitamin D toxicity might occur at an intake of 10,000 IU per day, which is 250 micrograms per day. Although they could produce no reproducible evidence that 10,000 IU per day has ever caused toxicity in humans, and only one poorly conducted study indicating that 20,000 IU per day may cause mild elevations in serum calcium, but not clinical toxicity. Viewed with different measure, this FNB report recommends that an infant should take 10 micrograms per day, that is to say 400 IU, and a pregnant woman 15 micrograms per day or 600 IU. As a single 30-minute dose of summer sunshine gives adults more than 10,000 IU, the FNB is apparently also warning that natural vitamin D input, as occurred from the sun before the widespread use of sunscreen, is dangerous. That is, the FNB is implying that God does not know what she's doing.
I like that.
Disturbingly, this FNB committee focused on bone health, just like they did 14 years ago. They ignored the thousands of studies from the last 10 years that showed higher doses of vitamin D helps heart health, brain health, breast health, prostate health, pancreatic health, muscle health, nerve health, eye health, immune health, colon health, liver health, mood health, skin health, and especially fetal health.
And health.
And health. Tens of millions of pregnant women and their breastfeeding infants are severely vitamin D deficient, resulting in a great increase in the medieval disease rickets.
Mm-hmm.
The FNB report seems to reason that if so many pregnant women have low vitamin D blood levels, then it must be okay because such low levels are so common. However, such circular logic simply represents the caveman existence, parens never exposed to the light of the sun, of most modern-day pregnant women, which, of course, is what has happened, is we've all gone indoors, and
sun's bad for you, don't you know?
And when we're outdoors, we're wearing clothes
Right.
and or sunscreen.
Yeah.
He says, hence, if you want to optimize your vitamin D levels, not just optimize the bone effect, supplementation is crucial, but it is almost impossible to significantly raise your vitamin D levels when supplementing at only 600 IU per day. Pregnant women taking 400 IU per day have the same blood levels as a pregnant woman not taking vitamin D. That is, 400 IU is a meaninglessly small dose for pregnant women. Even taking 2,000 IU per day of vitamin D only increases the vitamin D levels of most pregnant women by about 10 points, depending mainly on their weight. Professor Bruce Hollis has shown that 2,000 IU per day does not raise vitamin D to healthy or natural levels in either pregnant or lactating women. Therefore, supplementing with higher amounts, like 5,000 IU per day, is crucial for those women who want their fetus to enjoy optimal vitamin D levels and the future health benefits that go along with it. For example, taking only 2 of the hundreds of recently published studies, Professor Urashima and colleagues in Japan gave 1,200 IU per day of vitamin D3 for 6 months to Japanese 10-year-olds in a randomized controlled trial. They found vitamin D dramatically reduced the incidence of influenza A, as well as the episodes of asthma attacks in the treated kids, while the placebo group was not so fortunate. Dr. Urashima had followed the newest if Dr. Urashima had followed the newest FNB recommendations, it is unlikely that the 400 IU per day treatment would have done much of anything, and some of the treated youngsters may have come to serious harm without the vitamin D. Likewise, a randomized controlled prevention trial of adults by Professor Joan Lapp and colleagues at Creighton University, which showed dramatic improvements in the health of internal organs, used more than twice the FNB's new adult recommendations. Finally, the FNB committee consulted with 14 vitamin D experts, and after reading those 14 different reports, the FNB decided to suppress their reports. Many of these 14 consultants are either famous vitamin D researchers, like Professor Robert Heaney of Creighton, or, as in the case of Professor Walter Willett at Harvard, the single best-known nutritionist in the world. So the FNB will not tell us what Professors Heaney and Willett thought of their new report. Why not? Today, the Vitamin D Council directed our attorney to file a federal Freedom of Information request to the IOM's FNB for the release of these 14 reports. Most of my friends, hundreds of patients, and thousands of readers of the Vitamin D Council newsletter, not to mention myself, have been taking 5,000 IU per day for up to 8 years. Not only have they reported no significant side effects, indeed, they've reported greatly improved health in multiple organ systems. My advice, especially for pregnant women, continue taking 5,000 IU per day until your 25 OHD is between 50 and 80 nanograms per milliliter. The vitamin D blood levels obtained by humans who live and work in the sun, and the midpoint of the current reference ranges at all American laboratories. Gestational vitamin D deficiency is not only associated with rickets, but a significantly increased risk of neonatal pneumonia, a doubled risk for preeclampsia, a tripled risk for gestational diabetes, and a quadrupled risk for primary cesarean section. Today, the FNB has failed millions of pregnant women whose yet unborn babies will pay the price. Let us hope the FNB will comply with the spirit of transparency by quickly responding to our Freedom of Information requests. And I should just mention that this story produced the story in the New York Times produced a phenomenal response in people posting to the story. When I looked in the morning, there were already 255 some responses, and many had been redacted by the people at the New York Times, saying that they had protocols. They couldn't allow the level of fury that was being expressed, no doubt expletives and obscenities. So they were deleting these things, but there were a number of very knowledgeable responses from people who were saying, okay, this is just really irresponsible to be in the news.
It's a little odd. You know, and I noticed that since you raised my awareness on this, that my own doctor has started testing for vitamin D when he does blood tests. It's just kind of part of the routine blood tests now. My wife got hers back, and she was low. And he recommended, or she recommended, supplementation. Yeah. So
anyway, I know that it's been a big interest of our listeners ever since I did the podcast August before last, and I got this generated so much feedback that I wanted to cover it today and just say, they looked only at bone health. It is the case that much less D is necessary for bone health, much more necessary. Essentially, the level you would have if you were spending your days out in the sun and you were a young person near the equator, to keep you healthy. Right. So
I'm taking my